let me start recording here. So I got a little topic we can talk about today. It is covering seasonal spring respiratory illness. So just things that people are getting a lot of this time of year, maybe like some pneumonia, different respiratory illnesses like RSV, bronchitis, that kind of stuff. And then when you add in the seasonal allergy stuff, that just kind of adds fuel to the fire, so to speak. So,
Okay.
but so like you see people that this time of year maybe they kind of getting like I mentioned, like a bronchitis or even pneumonia, that kind of stuff, walking pneumonia, things like that. They're having to go to the urgent care quite a bit for. Of course, getting sick is, we're all going to get sick at some point in time. Obviously, it's our goal is to minimize those times and optimize our immune system so that we don't get sick as often. But it's just a normal way of life, especially if you have young children, right? Those young kids are bringing stuff in all the time. So and then you're not getting as much sleep potentially, and so then that just kind of wreaks havoc on your immune system and your overall health. So, but if we can minimize exposures and optimize our immune system, then there's better ways to treat to deal with these things rather than just having to take antibiotics all the time, especially for viral infections, which everybody, we get sick and we want to be feel better as soon as possible, quicker, as the quicker the better, right? Um,
Mhm.
but unfortunately, when it comes to a virus, there is no antibiotic that's gonna fix that or stop that. So you have to, it has to kind of just run its course. We get so many people coming into urgent care, they're wanting antibiotics. Oh, I've had this cough for a day or two, and it's like, yeah, it's probably not bacterial. It's only been a couple days. Most
Right.
common type forms of respiratory illness are viral. So even bronchitis, people think, oh, I got this cold, and then a week later, now I got this cough, and this cough is not going away, and then they think it's infectious, and it's really just that bronchitis, and it can take a couple months to finally go away. So that gets kind of frustrating for people who, you know, want to feel better and they have a constant cough, and
Mhm.
mucus. So a few things that you can do to kind of help with your immune system is one obviously is vitamin C, high doses of vitamin C, and this vitamin C is a, a key antioxidant for your immune, so it just helps kind of minimize the all the extra radicals, reactive oxygen species we call them. So they're basically like these rogue um, byproducts of viral and immune function. And so vitamin C can kind of help bring down those oxidative species levels basically so that it helps reduce inflammation and things like that. And it can help speed up the recovery from a virus. So again, just gives you that immune support. And so the recommended doses for vitamin C are about one to 2,000 milligrams 4 times a day. So it's again pretty high dose, and you will have to do it multiple times a day because it has such a short half life. So, um, but then there's also good
So,
sources of vitamin. There's food sources for vitamin C, and of course those are like fruits, like citrus fruits, strawberries, and bell peppers, things like that. So always, right? If you're eating junk food and then you're just taking vitamin C, I mean, you're kind of defeating the purpose of trying to be healthy, right? So uh, supplements are never a replacement for a healthy diet and regular exercise, but um, supplements are just that, are meant to be a supplementation to what you're already doing to kind of fill in the gaps of maybe what may be missing. Um, so another another important uh, vitamin or supplement that you could do is like green tea. It has some good antioxidant, anti-inflammatory benefits as well. And so it can also warm tea with some little bit of honey in there. It can be kind of an anti-inflammatory treatment for
Mm.
your throat. So if you have a sore throat, it can help reduce inflammation in your throat. And then green tea also has an antimicrobial component to it, so it helps kill off viruses and bacteria. So lots of good antioxidants, and that's kind of the key for your immune system is if you have a lot of oxidants or like I mentioned, they're kind of like um, waste products of cellular function. And when you have a lot of these, it just kind of gums up the system and your immune system has to kind of work around that. And then it just decreases the effectiveness of your immune system so that you're not functioning well and then you get sick more.
Mm.
So yeah, so green tea is a great antimicrobial immune support treatment to incorporate into your day. Again, adding some lemon or honey. Honey can also help with inflammatory and antimicrobial properties there. And another good immune support supplement is omega-3 fatty acids. So fish oil is anti-inflammatory, and so we typically our diets are more omega-6 prevalent, and omega sixes are more inflammatory. So we want to have as close to a 1-to-1 ratio of omega-3 to omega-6 as we can get, so that it helps balance out that inflammation. So uh, getting a good fish oil, high dose fish oil, could be helpful for helping lower inflammation and help support the immune system so that your immune system is not trying to fight all that inflammation and oxidation going on there. So, um, and then omega-3 is good for brain and your brain health as well. So that's one of the ones that we recommend a lot is just a good omega-3 source. And of course, there's food, right? Food that has omega-3, like the fatty fish. You might see like it's the acronym is SMASH, salmon, mackerel, anchovies, sardines, and can't remember what the H is now.
Herring.
Herring, yes, good job, thanks. Yep.
So when I was 1920, I ended up in Nome, Alaska. And during the winter time, the Eskimos would eat frozen fish and they'd dip it in hot seal oil.
Mm.
But when they would sweat, it would come out of their pores. Oh Lord, it was so bad.
It was potent, huh?
Oh my gosh.
Huh.
Yeah, you were in somewhere that was a little bit warm because it was, 30 below with the wind chill, but then start sweating and this odor was just whoa.
Sounds awesome. You're like, I'll go outside. I'm gonna sit outside. It's
Yeah. Ugh.
yeah. Hot seal oil, huh?
Yeah.
Marinating with hot seal oil. They're getting some good omega-3s there.
Oh man, oh man. They had beautiful skin.
Oh yeah, I bet. Yeah, so omega-3s are good. However you want to do that, I guess you can do the herring and hot seal oil if you want.
I'm a sardine and anchovies girl, so I'll manage.
Yeah, there you go. Good. Um, some other things you can do for respiratory relief is, hot showers, steam, to help loosen up the mucus and get that, be able to cough that out. Uh, it helps open up your airway, things like that, which is very important. A lot of times people are kind of shallow breathing, and then we try to suppress our cough because we don't, it's not, we don't want to sit there and cough a bunch, but really we need to kind of cough because we need to clear out that mucus and stuff out of there. So it's good to get in a hot shower or something like that and really just kind of let the steam, or even, boiling a pot of water and kind of putting your face over it with a towel or something just to kind of breathe that in could be
Mhm.
helpful. So um, you might have somebody, you could have one of your, a family member even kind of pound on your back a little bit there to back or chest to kind of break stuff up and loosen it up. Um, just to help you cough that up. So, of course, when you're sick, staying hydrated is extremely important. Just like just being healthy, right? Is that you need to drink plenty of water and fluids that can help thin out the mucus as well. Especially if you're taking like over-the-counter medications like Mucinex. Mucinex will thin the mucus so you can cough it up, but you definitely need to make sure you're drinking plenty of water if you're taking those kind of medications or even antihistamines or decongestants because they'll dry you out a bit. And a lot of people don't really get a lot of enough water, I think. So definitely make sure you're drinking plenty of water, staying hydrated. Um, Kind of a rule of thumb, at least half your body weight in ounces of water per day. Um, at least it could be, maybe more than that if you, get more. So if I'm 180 pounds, then, I need 90 ounces of water a day. So that could be a lot, but
Mhm.
yeah. So, and then, again, you get water not just through just regular water, but tea, coffee, broth, you get some water through your food as well, but so it doesn't have to be strictly water. Just kind of try to think about like other sources of fluid that you're getting as well. So that contributes to your water intake. So
Yeah, I try to get about 4 pints a day, and it's about 64 ounces. And I'm a 64-year-old woman, so I'm in the bathroom all the time.
I
It's like,
know that's
come on, man.
yeah, I know that's the only drawbacks. Like, well, the more water I drink, the more I have to go to the bathroom, and
Yes.
yeah,
Yep.
so it's 22 on that one, right?
Yeah,
Yeah.
yeah.
Yeah. So those are kind of our recommendations for getting through, the spring respiratory illness season. Lots of good antioxidants, vitamin C, green tea, omega-3s, staying hydrated, doing little, little things that you can do at home to help just kind of clear out mucus and help you breathe a little bit better. Um,
Mhm.
but of course, everything overall health really relies on us having a good foundational health, like we've talked about in our program, right?
Mhm.
So eating healthy food, uh, getting plenty of sleep,
Mhm.
managing your stress levels as healthy as you can. Um, of course, exercise and having good social, relationships and uh, social activities and social interactions are all important for just the baseline health. So there's other supplements too that can help with uh viral illness if you feel like if you feel like you're getting starting to get sick. Um there's one and we can kind of give you specifics. There's a supplement through Apex energetics, and it's called Viramin. And let me see. And it's got like, gonna look up the ingredients here. Um, but it's an herbal. So it's got, of course, it's got zinc, right? I mean, anything for the immune system, zinc's important. It's got echinacea, licorice root, astragalus, and then it has some lemon balm, maitake mushroom, pomegranate.
Spell spell it for me.
The uh the supplement,
Yeah.
it's X Viramin, X and then dash VIROMIN.
Okay.
And we can actually we have an account through Full Script that we can recommend it for you, or we can give you that website, and you can go on there and look at what supplements we recommend and order those. But
Hmm.
so yeah, so that's any thoughts, questions on that?
So do you think that the over-the-counter meds, do they just suppress those things and it has to work through, or do they actually cure it?
Over-the-counter medications are primarily for to symptom management, right? To make you help you feel a little bit better while your body is trying to get over this virus. The virus, your immune system just has to kind of work on that. So
Mm-hmm.
a low level fever is actually a benefit, in terms of it's your immune system. A lot of times the viruses are sensitive to heat changes. So our body you'll get a fever because your body's trying to basically cook the virus out, if that makes sense. So
Mm-hmm.
a low level fever can actually be kind of beneficial for you to kind of just let your body kind of deal with the virus.
Mm-hmm.
If you start to get a super high fever, then it may be something more than a virus. There are certain viruses though that can create a higher fever than others too. So I know we all like to kind of jump to like Tylenol or ibuprofen, right? When we have fever or flu like symptoms, but it could be beneficial to just really do what we talked about, maybe getting some vitamin C, green tea, maybe the vitamin supplement, and start taking those, and we kind of you have a little bit of a fever, kind of let that happen for a day or two, just to kind of let things kind of go on their own, let your immune system work on things,
Mm-hmm.
but it's no fun feeling sick, that's for sure, right? We all like, who's got time to be sick? But
No, no thanks. I'm good.
yeah, yeah, but just kind of take care of yourself when you are sick, and you know, try those things.
Right on.
Yeah. So, any other thoughts?
Cool. Thanks, Wiley.
Yeah. Thanks for joining again. I appreciate you getting on here, and yeah. So,
Yeah, why the heck wouldn't I?
yeah, good.
Right on. All right, my friend, I'll see you probably next week.
All right, Sherry. Okay, you take care.
Yep, you too.
Okay,
Bye.
bye.